cut off. Then I had a bit of a drop in my blood sugar, so I had to eat something. So there was a bit of a break in between, and I apologize. Okay. So sorry about that. Alright, so what we do as nurses. So primary prevention for substance abuse includes education about drugs and guidelines for use. So again, it's primary prevention, so you're trying to prevent substance abuse from occurring. So when we were in school, you had the DARE program, and they have lots of education programs on the use of drugs and drinking. That definitely plays a big part. And then also there's some communities where it's like, okay, we know the risk of someone getting into, for example, heroin use. A big population of those who've used heroin have some sort of history of chronic pain issues. So they started looking into how did it lead to heroin, and it led to heroin because they were on these like crazy narcotics for their chronic pain, and still their chronic pain wasn't controlled. So they're now finding that chronic pain actually does better with a different group of drugs that are not opioids, and then you get cut off from your chronic pain medication, and what do you do to get something similar in terms of control, and that's heroin. And I remember during my clinical, there was a woman who literally came in and she goes, I'm doing everything in my power to not start using heroin. But my pain is so bad, and I don't have insurance, and no one will treat me. And it was really hard to treat. And when you work in these community clinics, I mean, I don't provide a lot of the narcotic medication, but I do provide a lot of the chronic pain medication, and that was helpful for her. But they are expensive, so luckily now there's a lot more insurance coverage for the poor. Secondary prevention, that depends on a lot of screening. So if any of you come and shadow me, we actually have, we implement a lot of secondary prevention with drug and alcohol abuse through the use of, questionnaires, and then it actually will get flagged and sent to our substance abuse clinic, and they will, come in contact with these patients and be like, you're flagged, you have this history of drinking, and it sounds like it's based on your questionnaire that, you scored really high, and is there anything we can do to help you? Let me talk to you about, drinking, and especially with younger people, there's a lot of binge drinking that goes on. So high-risk groups include pregnant women, young people, older adults, intravenous drug users, and illicit drug users. Drug addiction oftentimes occurs within a family, and it becomes a family problem as well. So children might not get proper nutrition because the money, income in their family doesn't go to food, it goes to drugs or alcohol. So next we're going to talk about violence and human abuse. It's not new, violence and human abuse in the home. It is continuing to grow as a community health concern. Those who are victims of abuse tend to have worse health. They're more likely to be socially isolated, less likely to go and get proper preventative health care services, and so it directly affects community health. And then elder abuse is quite common. It's not just physical abuse. There is emotional, financial, neglect, and sexual abuse. Child abuse is particularly destructive as well. So again, there's lots of screening methods. Secondary prevention, again, unfortunately, it's really hard to actually prevent abuse, but catching it early before somebody is in the hospital or the sequela is so bad, is the key. So we identify potential victims through, school nurses often are the first to catch it. Teachers are trained in that. And then also there's, some clinical guidelines that you go into. So now we're going to talk about Chapter 26, Infectious Disease and Prevention Control. Infectious disease is a big problem. This year we had a really terrible flu. And it was mainly terrible because, unfortunately, the vaccine that was created for it did not cover the most prevalent strain that was spreading this year. So there was actually, 12 deaths in Cincinnati just among children from the flu. That's quite high, and especially from something from the flu. And in the elderly, there was a lot of hospitalizations. I think over 450 hospitalizations, and there are 30 elder deaths from the flu. Infectious disease isn't just the flu, obviously. We know STDs are one, tuberculosis, HIV/AIDS is a big one, not necessarily in my area of town. I don't know where some of you guys in your communities it might be a problem. And so preventing these diseases are always given a high priority. Why? Because infectious diseases are particularly virulent and they spread quickly, thus the term infectious disease, right? So the successful interaction of the infectious agent-host environment is necessary for disease transmission. So knowing how things get spread is really important as a nurse. And I'm sure you remember during your boards, they asked you questions like, your patient has C. diff. What type of precautions do you expect them to be in? And you're like, contact precautions. Your patient has tuberculosis. What type of precautions do you expect them to be in? And they'll say, airborne. So this year we had the big Ebola scare, and it wasn't airborne, it was contact. And so talking about ways it gets transmitted and understanding how to properly gown and degown was quite the area of controversy in this country. But that's really key. So I work for the city of Cincinnati in the community health, so we had to go through all this crazy training for Ebola because most likely you would see it in a community health setting. Communicable diseases are preventable, and preventing infection through primary prevention activities is the most cost-effective public health strategy. So primary prevention, we talked about this course before the disease hits. So what are things we can always teach to prevent communicable diseases? Cover your mouth when you cough, wash your hands, get vaccinated. When you travel to places that have other infectious disease, make sure that you get vaccinated before you go to those host countries. And then, of course, healthcare professionals are always under the most strict infection control principles with standard precautions, and then other precautions depending on what the disease is. So effective control of communicable diseases requires the use of multi-system approach focus to improve resistance of the host, right, and improving safety of the environment. So when we test people for TB, that's not primary prevention, that's secondary prevention. How can we prevent TB on a primary level? Okay, so they don't vaccinate in this country against TB. In fact, I think the TB vaccine they only use in Africa and in certain areas of South America. So TB is spread in crowded environments. So trying to improve low-income housing, that's a great way to prevent the spread of tuberculosis. Ensuring proper ventilation. Ensuring that people have a good immune system, because again, a good immune system lessens the likelihood of you catching TB. So improving nutrition. Those are some primary ways we can prevent communicable diseases. Okay. So nearly all communicable diseases that we're about to discuss are preventable because they're transmitted through known behaviors. The main one we're talking about are STDs or STIs. So sexually transmitted diseases, sexually transmitted infections. So here's the deal. So some are infections, some are diseases. So I would like to hit